The gold standard of treatment for obsessive compulsive disorder is something called exposure and response prevention therapy. It's really two things that we do. Number one, we purposely want to expose people to things that are uncomfortable. These are the obsessions that they have. And obsessions are intrusive thoughts, images, and urges that people experience. And they might say that they're inappropriate to them, or they're unwanted, and they're intrusive, and they just lead to a lot of discomfort. And so they attempt to neutralize them with some other thought or action. That's what a compulsion is. So in ERP, or exposure and response prevention therapy, we're purposely exposing people to those obsessions, and we're asking them to not do a compulsion. What is a compulsion, again? That mental or behavioral act? That's the thing that we need to prevent, because it turns out it's the compulsions that are actually maintaining obsessive compulsive disorder. That's why the therapy is called response prevention, because we're trying to prevent a typical response. And what is the typical response in OCD? The compulsion. By eliminating the compulsion, we allow people to learn that they can handle whatever their intrusive thoughts or images or urges are. Sometimes we need more than ERP work, and that might bring in medications as well. Typically, people start with the SSRIs or the SNRI medications. These are serotonin selective or other types of neurotransmitter selective medications where it blocks some of the reuptake of it. Basically, it keeps more of that, shall we say, neurotransmitter in the synapse of the neuron itself, which means that it has more chance to bind with the next neuron, creating more action potentials, more excitement in the brain, and therefore more messaging that we would want to have. If those medications don't work, it could be because you're not seeing a specialist. Specialists will prescribe these medications at the level that they need to be, but people who are not as familiar with OCD might only go to a certain level. And this could be a problem because OCD dosages are typically higher than the typical antidepressant dosages. These drugs are typically referred to as antidepressants, but they work on things more than just depression. For people who need more than that, there's higher levels of care for treatment. There's intensive outpatient programs, or IOP. There's partial hospital programs, or PHPs, and there's even residential treatment centers. And for people who want things on a different side of this, there's deep TMS, which is a transcranial magnetic stimulation that you can have done to your brain, where it will use magnetic pulses to help make some changes that are going on in the brain. There's a stereotactic radiosurgery, which is a bloodless surgery that uses gamma radiation to literally burn a small hole inside of the brain on either side of the brain to kind of destroy some of the pathways in the brain that OCD utilizes. And there's even something called DBS, or deep brain stimulation, where you can insert leads into the brain and you can create an electrical field in the brain with these leads that competes with the brain electrical field that it normally has.